Natural diagnosis for dementia and Alzheimer's. Aging is a natural process that occurs to all humans. Our bodies alter in numerous ways as we age. Our skin tone, hair color, and muscle tone vary over time, and our bodily functions become slower and weaker. Furthermore, aging results in modest memory modifications. Occasionally, this is simply an unintentional memory loss. Progressive loss of short term memory, on the other hand, may require rapid medical treatment as an indication of dementia or Alzheimer's disease. This latter type of dementia is the most common. It wreaks havoc on brain tissues, resulting in aberrant brain variations. With over 50 possible causes of dementia, it is strongly recommended that you receive a comprehensive medical evaluation. Although there are no definite diagnostics for Alzheimer's disease, a number of tests can be performed to rule out other treatable causes. However, medical advancements have resulted in the development of experimental blood tests such as presenilin, which can detect an early onset of a gene mutation, and AOE, which determines your chance of getting Alzheimer's disease. As Alzheimer's disease progresses, you may discover that you become increasingly reliant on your caregiver for even the most basic activities. Certain everyday actions that you previously performed independently may require the caregiver's supervision or support. Managing financial affairs and engaging in normally risk free activities such as cooking, driving, taking prescriptions, or taking unsupervised walks may become dangerous at any time. In the later stages of the disease, ordinary actions such as clothing and daily hygiene may grow beyond the affected person's ability and finally become the caregiver's burden. Denial is a frequently used and natural strategy for resolving this issue. If you want someone to acknowledge to having dementia, you must first create a sense of support and safety for them. Make no attempt to persuade them that they are suffering from this ailment. Offering emotional support and discussing their anxieties is a more effective strategy to elicit a good response. Changes in the brains of the majority of patients result in memory loss, impaired judgment, and thinking, making it difficult for them to make sound judgments. When you ask the patient to make choices, you may cause them to feel anxious about their situation, ascertain that circumstances requiring decision making are kept to a minimum. A person with Alzheimer's disease frequently exhibits symptoms of paranoia, which are caused by impairment to the area of the brain responsible for separating fact from fiction. Additionally, some individuals may do this to avoid confronting the unpleasant reality of their medical situation. It is impossible to persuade a patient that their wallet was not stolen. Thus, save your time and energy. Rather than that, place yourself in their shoes and assist them in locating it. Many adults consider driving to be autonomous, competent, liberating, and a way to maintain control. It enables the purchase of essentials, access to healthcare, productivity, and connection to friends, family, and community. When it comes to driving, dementia is a significant risk. However, alterations and disorientation in memory, response, and sense of time can make driving extremely unsafe for both the affected person and others on the road. It is critical that the family monitors the patient's driving abilities and that a doctor addresses the issue by informing the patient that they must stop driving. Additionally, you may engage them in discussions about when driving should halt to ease the transition. In essence, people who have recently been diagnosed with either of these illnesses are typically depressed. This is typically accompanied by sobbing, withdrawal, altered food habits, agitation, feelings of worthlessness, and altered sleeping patterns. Additionally, it is normal for individuals to have considerably impaired cognition and ability to defend against sickness. This has a significant impact on their outlook on life. Although antidepressants can be used to treat depression, the most effective treatment is socialization. When someone has dementia and is isolated, they become more focused on the activities they can no longer perform or their limits. On the other hand, when they are in social situations, such as senior living communities or daycare centers, their focus might be shifted to the external environment. Understanding that life changes are a part of the process rather than the end of life will assist you in treating the problems and leading a healthier and happier life. When a doctor confirms the presence of dementia or Alzheimer's disease in a loved one, most families are anxious that their loved one may panic or become despondent, speeding up the degenerative process. In other instances, though, the converse may be true. Keeping someone in the dark regarding the source of their issues may aggravate the condition, as they will often attempt to recall information desperately, and when they are unable to, they will feel upset, agitated, and occasionally melancholy. They need to understand what is causing their pain and that it is not a natural part of aging. This enables them to gain a better understanding of the disease and develop a more receptive attitude towards lifestyle changes. Dementia is notoriously difficult to diagnose, much more so in its early stages. The patient should consult their general practitioner first, who will then send them to the appropriate medical practitioner. Several of the assessments involve speaking with the subject and those who know them, as well as a physical examination, brain scans, and memory tests.